we're going to scan the room. This is everything I need for my assessment. We're doing our assessment here. Okay. Okay. All right. My name is Rachel Hewlett. This is validation video number 1. Just a disclaimer, I'm only going to do tests unilaterally. I'll verbalize if it should be bilaterally though, but I'm just going to try to save myself some time. Okay, so we're going to start with cranial nerve number 1. It's the olfactory nerve. This is sensory function. So we're going to do nasal patency first. You can take your glasses off for me. Occlude one side of your nose, breathe in and out. Do the other side. Perfect. Now we're going to test smell. Close your eyes. Occlude one side of your nostril for me. Tell me what you smell.
Coffee.
Good. Occlude the other nostril. Tell me what you smell.
Peanut butter.
Good. Okay. So cranial nerve 1 is intact. We're going to move on to cranial nerve number 2. This is the optic nerve. This is also a sensory function nerve. Okay. First, let's do the Snellen chart. So I'm going to stand 6 feet away, and you're going to, you normally wear glasses, right?
Yes.
Okay, so I'm going to have you put your glasses on. I'm going to stand 6 feet away. Read the lowest line possible for me.
FTFPH. LTFPH.
Okay. So yeah, it was LTFPH. So you were wrong the first time, but right the second.
Yep.
So your vision was 20/20 with the Snellen chart, which means that 20 feet, you can see what a normal person can see at 20 feet with your corrected vision. So good job. If for some reason you had missed more than 2 letters per line, we would have just gone up a line and given you that score. Okay, now we're going to do a peripheral vision test, known as a confrontation test. So I'm going to have you cover your left eye. Is it good and covered around this side over here?
Mm-hmm.
Okay, perfect. I'm going to cover my right eye as well. I'm going to start with my hand above my head superiorly, and I want you to tell me, look directly in my eye, okay, and tell me when you can see my fingers wiggle.
Yes.
Okay, good. Now we're going to do it nasally. Tell me when you can see my fingers wiggle.
Yes.
Okay. Now we're going to do inferiorly. Tell me when you can see my fingers.
Yes.
Okay. And then I'm going to move a little bit closer to you. And I'm going to start from behind your head. Tell me when you can see my fingers.
Yes.
Okay, good. So that was 90 degrees. So that was normal for that side. Everything else was normal as well. We saw my fingers wiggle at the same time. If for some reason we saw them at different times, I could then look at degrees of variation. 50, 60, 70 degrees are what are normal for superior, nasal, and inferior. Okay, so next we're going to do the fundoscopic exam with the ophthalmoscope. So I'm going to have you look at a spot on the wall. You can look at that deer if you'd like. And I'm going to be looking at your left eye, okay?
Okay.
So I'm going to use my left eye for your left eye. You're going to notice me shine a light in your eye, okay? And I'm going to place my hand on your forehead. Okay, so I'm looking for the red reflex, which I can see. So now I'm going to move in closer, and I'm going to start more medially. And I'll discuss landmarks when I'm done looking. I'm going to go laterally now. Okay, great. Okay, so things that I saw in that exam, I saw a pretty normal exam there. I could see the red reflex on your cornea when I was out here and as I moved in all the way around from medial to laterally. I saw your optic disc, and it had really sharp margins. Things I don't want to see are dull margins. I saw your physiological cup. It was less than half the size of your optic disc. If it was greater than half the size, that would be abnormal. I could see arteries and veins, and there was no nicking on any of those. And I could see your retinal background. It was light pink in color. If it was really dark red and concentrated, that could be signs of hemorrhage. We don't want to see that. Another thing I don't want to see are like woolly patches. And then lastly, when I got to this lateral side, I could see your fovea and your macula, and I could see that there were cones present. So overall, that was a normal exam. We're going to move on to cranial nerve number 3. This is the oculomotor nerve, and it has motor function. We're going to be testing it along with cranial nerves 4 and 6, the trochlear and abducens nerves as well. Okay, so we're going to start with Perla. So if you'll just find a spot on the wall back there, I'm just going to first look at your face. I can see that your pupils are equal and round bilaterally. Now I'm going to test the reaction to light. So just keep looking at that spot on the wall for me. You're going to see me shine a light in your left eye. Okay, great. And keep looking at that spot on the wall for me again. Just shine it again. Okay, perfect. So before I showed the light in his eye, his pupils were at about 6 millimeters. It's a little dim in here. And when I shone the light on his eye, they actually went down to about 4 millimeters. There was a consensual and direct response to the light between both of the eyes. I would repeat it on the other side, but to save time, we're going to move on. Now we're going to test accommodation. So if you'll just look at my finger, I'm going to bring it into your nose and just follow it as best you can. Okay, perfect. So the eyes did accommodate. They converged and came in together as I brought my finger into his nose. So overall, we have Perla, we have a normal exam. Good job. Okay, what's next? I have to think. Oh, yes, we are going to test extraocular movements. I'm going to use the H method exam. I'm going to be looking for any abnormalities like nystagmus. So I'm just going to have you follow my finger and keep your head still, but follow it with your eyes, okay?
Yeah.
You're doing good. You're doing good. Don't move your head. Okay, I didn't see any nystagmus, so that was a normal exam. Lastly, we're going to do a corneal light reflex exam. So just look at that spot on the wall for me. You're going to see me shine a light on the bridge of your nose. Perfect. So what I want to see there is the light reflects symmetrically in both of his eyes, and I did see that. If for some reason I didn't see that, I would want to move further and maybe do a test for strabismus and weakness in the eye muscles and do the cover-uncover test, but we don't need to do that now. Okay, so next is going to be cranial nerve number 5. This is the trigeminal nerve, and it has motor and sensory function. Okay. So let me see your arm. So I'm going to show you what a dull feeling feels like. This is dull. Can you feel that?
Mm-hmm.
And this is sharp. Do you think you could tell the difference between those?
Yes.
Okay, so sharp, dull.
Okay.
Okay. And so I'm going to have you close your eyes. You can rest your arm down for me. I'm going to be touching 3 different places on your face. Your chin's going to be a little hard to get to with your beard, but that's okay. We're going to do eyebrows, cheeks, and chin. I'm only going to do one side of the face to save myself a little time, but normally we would do both. So tell me what you feel.
Dull. Sharp. Sharp. Dull.
I know your beard's a little hard to do.
Sharp.
Okay, and then?
Dull.
Okay, good job. Okay. And so that was also a normal exam. Now I'm going to test some strength and symmetry and some facial muscles. So I'm going to place my hand on your cheeks here, and I want you to clench down your jaw. Okay, good. Okay, now move your jaw side to side for me. Good. Any pain or tenderness?
Mm-mm.
Okay. So he had symmetrical strength in his jaw muscles, and everything looks good. It was moved symmetrically, moved smoothly, no popping. So that was a normal exam.
Okay.
Next, we're going to move on to cranial nerve 7. This is the facial nerve. There's motor and sensory function in the facial nerve as well. So close your eyes really tight for me. Sit up straight for me just a little bit. Good. Close your eyes really tight. Open them. Lift your eyebrows high. Good. Show me your teeth. Top and bottom. Good. Smile for me. And puff out your cheeks. Good job. Okay, so overall I see symmetry in his face while it moves. I see symmetry between the palpebral fissures between his eyes, on his nasal folds, and the corners of his mouth. So all of that looks normal. Lastly, for the facial nerve, we're going to test taste on the anterior 2/3 portion of the tongue. So you can close your eyes for me and open up your mouth, and I'm just going to place something on the tip of your tongue, okay?
Okay.
And tell me what you taste.
Sugar.
Good job. That is correct. Okay. So we're going to move on to cranial nerve number 8. This is the acoustic nerve. There is sensory function here. So I'm going to start with a whisper test. I'm going to stand behind you about 3 feet. If you will cover your left ear for me, get it real good and closed, like occluded. Like maybe put your fingers on it. Yeah, there you go. Perfect. Okay. I'm going to whisper 3 words, and then I want you to tell me what those 3 words are, okay?
Okay. Apple, horse, 3.
Correct. So now I would do it on the other side, but to save time, we're going to move on. Now we're going to do the Weber test. I'm going to strike this tuning fork, place it on your head. I want you to tell me if you can hear equally on both sides, okay?
Okay.
There we go.
Yes.
You hear it on both sides equally?
Mm-hmm.
Okay, perfect. So that is a normal exam. If it were to lateralize to one ear where there was suspected hearing loss or an affected ear, then we could assume there was conductive hearing loss, and if it lateralized to an unaffected ear, that would be sensory neural hearing loss. I'm going to strike this again. We're going to do the Rhine test. I'm going to place it on this bone behind your ear right here, your mastoid bone. You're going to tell me when you stop hearing that noise, and then I'm going to place it right in front of your ear and tell me again when you stop hearing it, okay?
Okay. Okay. Okay.
Okay, good. So that was about a 2-to-1 ratio. So air conduction was greater than bone conduction by 2 to 1. That's normal exam. If for some reason the bone conduction was longer than the air conduction, then we could assume there was a conductive hearing loss. And if for some reason the air conduction was longer than the bone conduction, but it was greater than a 2-to-1 ratio, then we could assume some kind of sensory neural hearing loss. Okay, good job. So we're going to move on to cranial nerves 9 and 10. This is our glossopharyngeal and vagus nerves. They have sensory and motor function. So first I'm going to taste test on the posterior 1/3 portion of your tongue. And you're also going to tell me if you can feel me touch it as well, okay?
Okay.
So we're going to do this again. Close your eyes for me. Open wide. I'm going to get my pen light just to make sure I'm...
Sugar.
Okay, good. Could you feel me touch back there?
Yes.
Perfect. Okay. Now can you swallow for me? Is it hard to swallow?
Yeah, sure.
Okay. Any difficulty swallowing, or do you feel like there's anything obstructing the... No?
No, ma'am.
Okay, good. Any pain or tenderness?
Nope.
Okay, good. And then lastly, we're gonna do the ah test. I don't have a tongue depressor, so I'm just gonna use this to lower your tongue a little bit so I can see the back of your throat. I'm not gonna touch the back of your throat, okay?
Okay.
So open wide for me. Say ah.
Ah.
Say it one more time.
Ah.
Okay, perfect. So I saw equal rise and fall of the uvula, and it was symmetric on both sides, so that's normal. At this point, I could do a gag reflex exam if he was maybe unconscious, but we're not going to do it on him since he is alert and oriented. There's no need for that. Next, we're going to do cranial nerve number 10. This is our spinal accessory nerve, and there's motor function here. So sit up a little bit taller, face me just a little bit. Okay, so we're going to test the trapezoid muscles first. Meeting resistance, lift your shoulders up. Perfect. So they are symmetrical in strength on both sides. Now we're going to test your sternocleidomastoid muscles in your neck. So meeting resistance, turn your head into my hand. Good. And then do the other side. Perfect. Okay, and so those muscles are also strong and symmetrical. Lastly, we're going to do cranial nerve number 12. This is the hypoglossal nerve. This nerve's really simple to test. It's motor function. Stick your tongue out for me. Wiggle it around left and right. Good. And now use your tongue to poke out your cheeks. Great. And so there's symmetry there. There's symmetry and strength in the tongue muscles, so that's normal. That's good. We're going to move on to inspecting your head and face and scalp and hair. So first I'm just going to palpate your head, okay, and your hair. So I'm feeling for any lumps or bumps. Is there any pain or tenderness during this? Okay.
Mm-mm.
And then I'm going to actually get in and kind of look, separate the hair and look at the scalp, trying to note any lesions or abnormalities in skin characteristics, maybe any nevi, which are moles. Okay. So I don't notice anything abnormal in regards to lumps or bumps or moles or anything. The hair is nice and thick. It's soft. It's got this nice brown color to it. It's evenly distributed across his scalp. And so overall, his hair seems normal. If it was really dry, coarse, brittle, I might start to get concerned about whether he had a hypo or hyperactive thyroid, and we could look further into that. Okay, so his face, just from looking at it, looks very symmetrical between the palpebral fissures between the eyes, nasal folds, and the corners of the mouth. And overall, in regards to his head with the rest of his body in proportion to it, it's very normocephalic. His head is not larger or smaller than it should be. Okay, sit up tall for me one more time. Thank you. Okay. All right, so now I'm going to palpate your face a little bit. We're going to do your paranasal sinuses. So I'm going to palpate right here and right here. Tell me if you feel any pain or tenderness. This is the maxillary sinuses. And the frontal. Any pain or tenderness?
Nope.
Okay. And now we're also going to do the temporomandibular joint. So you can open your eyes for me. Open and close your jaw. Good. Close it. Okay. Any pain or tenderness there?
Mm-mm.
Okay. It felt pretty smooth to me. Did it feel smooth to you?
Yeah.
Okay. I didn't notice any popping or crepitus, so that's a normal exam as well. Now I'm going to take a look at your ears. I'm going to look at both of them and compare, looking for alignment and symmetry. But to save myself some time with this exam, I'm just going to assess one. I'm going to look at the auricle and palpate it. I'm going to look at the tragus and palpate it and palpate the mastoid bone, looking for any tenderness. We're going to do the tug test where I pull up on the pinna and palpate the tragus, looking for tenderness. Is there any tenderness?
No.
Those could be signs of an external ear infection. I'm going to be looking again at the skin characteristics, any lesions or moles, looking for any fluid in the external ear canal as well that could be signs of otitis externa. And I don't see any of those. This ear looks relatively normal. So then we're going to move on to our otoscopic exam of the ear. This was the one I was using on the ear. Okay. Okay, so for this part of the exam, things that I want to see are like a pearly gray color in the ear canal and the tympanic membrane. I'm going to want to see the handle and short process of the malleus, and I'm also going to want to see in the left ear a light reflex at 7 o'clock. If I were assessing the right, I'd want to see it at 5 o'clock. Things I don't want to see are going to be erythema, edema, any fluid buildup, bulging or retraction of the tympanic membrane, and I don't want to see a diminished light reflex on the membrane either, because those could all be signs of otitis media. Okay. So I'm going to pull up and back a little. Start at the external ear canal, work my way in. Okay, great. And I don't see any of those abnormalities that I mentioned, so that is a normal exam. Now we're going to move on to your nose. If you'll just tilt your head up slightly for me, I'm first going to look at the nasal septum and see if I see any obvious deviation, and I don't. Good, you can drop your chin. I'm going to look at the nose, looking again for symmetry, skin characteristics, lesions, or any other kind of abnormalities, and I don't see any either. We're going to test nasal patency one more time, so if you'll occlude your nose, breathe in and out for me. Do it on the other side as well. Perfect. Now I'm going to actually look in the nose. I'm going to look at the nasal mucosa and the nasal turbinates. I'm going to be able to see the medial and inferior turbinates. I won't be able to see the superior ones. They're just going to be a little too high. I want to see pink, a pink light red color, and I want to see that they're moist. I don't want to see bright red colors or super dark red colors. Those could be signs of infection, and I also don't want to see any like gray, boggy consistencies. Not that that's necessarily bad or a sign of infection, but that is a sign of chronic allergies, and it would be an abnormal finding. Okay. So if you'll just lift your head up for me slightly, I'm going to place my thumb on the tip of your nose just a little, okay?
Okay.
Sorry, I know. Okay. And this exam does look normal in the left side. I would also do the right side, but for time purposes, we're going to move on. Okay. Next, I'm going to look at your mouth. So the lips are nice and pink and moist. Open wide for me. If I had a tongue depressor, I would use that, but I don't have one. I'm going to look at the buccal mucosa, and I'm going to move the lips and the tongue around so that I can look at the gums. I'm looking for any lesions, and I don't see any. I see a nice pink moist color. The teeth, I'm looking for any missing teeth or obvious dental caries, which I also don't see. I'm going to look under the tongue. Can you lift your tongue up for me? Great. Looking again for any discolorations or anything abnormal, lesions. Don't see any. Drop your tongue down. Looking at the tongue, it's nice and pink and moist. You can close your mouth a little bit. There you go. Now I'm going to look at the back of the throat. Drop your tongue down for me. Say ah.
Ah.
Say ah again.
Ah.
One more time.
Ah.
Okay, and I'm going to look at the hard and soft palate. Okay, so the hard and soft palate are nice and pink. I don't see any jaundice. They're moist. The back of the throat, I don't see any abnormal drainage. It's nice and pink as well. Just a light pink color. Same with the uvula. It rose and fell symmetrically. And I can see the tonsils, and they're about 1+. They're very small in the back of his throat. Do you have any tenderness or pain?
Mm-mm.
Okay, so that would be considered a normal exam. I didn't see any enlargement or exudate on the tonsils. Lastly, we're going to assess your neck. So I'm just going to look at it. Sit up nice and tall for me. Looking for symmetry, which I see. Things I don't see, which would be abnormal, are tracheal deviation, enlargement of, obvious enlargement of the thyroid or goiter, or any other masses. So now I'm going to stand behind you. We're going to palpate your trachea. And I'm going to find some landmarks. Look up just slightly for me. I'm going to find the thyroid cartilage, cricoid cartilage, and isthmus of the thyroid. Now we're going to do a swallow test. So look down into your right for me. Look up just a little bit. Perfect, right there. I'm going to displace the trachea over to the right. I've got my finger here between the sternocleidomastoid. Now swallow for me. Okay, perfect. Do you notice any pain or tenderness there?
Nope.
Okay, and I don't feel any like nodules or enlargements in the throat, so everything feels normal to me. Nothing feels abnormal.
Okay.
Lastly, we're going to assess the lymph nodes. I'm going to start in front of the ears doing the preauricular, move behind the ears to the postauricular. We're going to test the occipital ones, right under the jawline, the tonsillar, the submandibular, and the submental. We're going to move down the neck to the superficial cervical chain and the deep cervical chain at the sternocleidomastoid, the supraclavicular above the clavicle, and the infraclavicular below the clavicle. And I don't feel any lymph nodes at all, which is a normal finding. Less than 1 centimeter, soft and mobile is normal. Greater than 2 centimeters, hard and fixed is abnormal. And that concludes this exam.